Hello there. Recently, I covered few topics regarding lifestyle, physical activity, and general health. So today, I got a straight up physio subject for a change: golfer's elbow and tennis elbow. After the low back pain, golfer's and tennis elbow is probably one of the most common dysfunctions, which makes it worth covering. Contrary to what its name suggests, it is not that specific to athletes. It is, in fact, very common in general population. What also inclined me to making this video was the recent debate on tennis elbow, which went pretty viral in the physical therapy part of social media. And even though I'm not gonna cover its contents directly here, I want to point out that it lasted for over an hour. Golfer's and tennis elbow isn't an issue that you can cover in a single minute, like I did with some other topics, but it still can be explained briefly and straight to the point. And that's what we're gonna do today. At the start, to be clear, what are we talking about? Golfer's elbow is a dysfunction and inflammation at the origin point of the flexor muscles on the forearm, which is located on the medial epicondyle of the humerus. It is the bony prominence on the internal side of the elbow joint. Tennis elbow is a similar dysfunction at the attachment point of the extensor muscles on the lateral epicondyle of the humerus, on the lateral side of the elbow joint. The mechanism by which they occur is basically the same: incorrect movement patterns, too much overload on the forearm muscles in situations in which you engage them and which, most often, require wrist movement. Overloaded muscles irritate their attachment point, which leads to inflammation. This results in a nagging pain in the attachment area, which can sometimes radiate along the forearm muscles. The pain usually gives the sensation of tension. It can also be stabbing. It is felt especially during elbow and wrist movements and also while contracting the forearm muscles. You can encounter these injuries among golfers and tennis players, sure, but also among athletes of other disciplines, but very often it is a problem of general population. People who, for example, pick up or move stuff around on a daily basis, so construction or warehouse workers. People who have to use their wrists a lot in non-optimal positions, so barbers or dentists. Fun fact, probably the most common cause among strength trainees is improper bar placement in the squat, where elbows and wrists are in a compromised position and too much of the weight is supported in hands. The reason golfer's and tennis elbow is so irritating of an issue is that it easily turns subacute and chronic and becomes really hard to treat. It has to be said that standard methods of treatment, which include procedures like laser therapy, ultrasound, anti-inflammatory drugs, steroid or plasma injections, are almost never effective. Because of that, not so long ago you could often hear, and you sometimes still do, that it can never be permanently healed. It is not true. It can be healed. We just have to properly understand its mechanism and to know how to approach it. The very first thing that needs to be pointed out is that golfer's elbow and tennis elbow is a tendinopathy, so dysfunction within tendons and muscle attachment points. Another common example of tendinopathy is the so-called jumper's knee. The specific feature of tendinopathy is that it doesn't heal on its own with time, as opposed to other common types of injuries like muscle strains. Let's say that you've gotten a tennis elbow by actually playing tennis. You hope that it's gonna heal with rest, so you stop playing for some time. You may not play for as long as 5 years, and indeed, while you don't play, the pain doesn't bother you. But once you go back to the activity that caused the problem, even after a 5-year break, right at the start, you're gonna find out that the pain is exactly the same at the same spot. So since it doesn't heal on its own, you have to do something to make it heal. To understand how to do it, I want to bring up an interesting story regarding horse rehab. On the back side of the horse's leg, through its entire length, runs a tendon, which sometimes gets inflamed in a similar mechanism to our golfer's and tennis elbow. And in the same way, it doesn't heal with rest. A horse with such an injury has been considered useless, but there was a method, I'm not sure if it's still being used, called pin firing. With a piece of red-hot iron, they were making a series of burns for the entire leg length on the both sides of the tendon. I know it sounds horrifying, but it was incredibly effective. Why? That way, they created a very acute inflammation in a large area, which in the process of healing itself also included the chronically inflamed tendon, forcing it to heal too. Now, I'm not suggesting that we burn our elbows with iron, but the principle remains the same. We need to turn an unproductive chronic inflammation into an acute one, forcing the injury area to granulate, rebuild, and heal. This is the crucial point which can discourage some patients, but they need to understand it. Because with this type of injury, we first have to make it worse before it gets better. So how do we do that? The best course of action is to pick an exercise which irritates your elbow pain. What pretty much always works for both tennis and golfer's elbow is the chin-up. In order to actually increase the inflammation, we need to approach it progressively. That means gradually increasing volume, so total number of reps and sets. For example, on the first training session, you do 5 sets of 2 chin-ups. On the next session, 5 sets of 3, and then, for example, 6 sets of 3, and so on. The exact parameters don't matter that much since A, our primary goal here is rehab, not necessarily the most optimal training. And B, the ability to do many chin-ups is gonna vary greatly from person to person. But even if you can do only 1 chin-up at a time right now, that's not a problem. Just make sure that you increase your total number of reps done over time. And if you can't chin at all, we can alternatively use different, similar exercise. In any case, for the course of such rehab training program, you will first experience the aggravation of symptoms, and then it will start getting better. And over the course of usually 3 to 4 weeks, your golfer's or tennis elbow is healed. It happens every single time. Which of course doesn't mean that you can't get it again if you don't change your habits that caused it in the first place. Here I can already hear the reactions, especially from other physical therapists that may be watching this, that it's absurd, that healing injury that is so notorious for being hard to treat isn't that simple. But it really is. It's not my fault that the vast majority of doctors and PTs doesn't understand this basic feature of tendinopathy. And also, it isn't some secret method I personally invented. There are other practitioners who use it with similarly great results. If someone claims that such a method doesn't work, then he simply hasn't tried it. There is a pretty big group within our industry which cares only about what the peer-reviewed studies say, irregardless of their quality, but doesn't care at all about phenomenology, so what actually happens in reality. Backtracking to the subject, there are other methods which can be helpful in treating golfers and tennis elbow, like some forms of manual therapy, or, here I also speak from experience, dry needling. In some less chronic cases, they may actually be sufficient, but using the chin-up method has a big benefit of also strengthening the injured area and surrounding tissues, since you effectively train it progressively. That will also reduce your probability of that same injury occurring again. And that is pretty much all there is to it. When approached practically, it really isn't that complicated. But it's not the first or last example of physical therapists making things way more complicated than they need to be. Why is that the case? We will talk about it on some other occasion. If you still have a problem with golfers or tennis elbow, even with the advice from the video, you can always message me on my Facebook page. Also remember to subscribe and like the video if you want to help the channel grow. See you next time.